Hello everyone, how are you? Hope you are doing good and happy Diwali. I missed Dashra also. Happy Dashra, happy year ahead. And I wanted to make this video from very long time. What is that few things which a dental student usually miss on and then become a disaster? Then the career choice becomes lousy and people start having this doubt of whether the career choice was right or wrong. So there are few factors which a dentist or a dental student, once you take up dentistry as your career or profession, you should have few things in your mind sorted out. If you don't sort this out, later date, you will find trouble in establishing yourself, becoming good in whatever field you're choosing. So field in the sense, if you want to become a prosthodontist, endodontist, or implantologist, or a clinical practitioner, or an whatever choice you wanted to make. So there are few basic points I wanted to actually highlight. If you can, suppose you join dentistry today, or suppose you want to change your life in dentistry today, then you should write down these things and start working towards it, right? First is the first very very important aspect of career choice as dentistry is, first is what is that thing which you want to achieve after 10 years. I made a video on this, you can go back and watch that. First is what you want to achieve. I mean, is it money, is it fame, is it just the art form you like, whatever thing you wanted to decide, so decide on that. The other important point which dental students or dentists usually miss is they think dentistry as business. So first sort this out. This is not a business at all. Whatever methods you apply, whatever things you wanted to do, whatever mindset you have, whatever feed you got in your brain, whatever methods you are applying, do not take dentistry as business. I can earn lot of money, I can become multimillionaire, or you can become, but do not think as a business. First, they keep this as clear as possible, as crystal clear as possible. Do not take dentistry as business. For that matter, any medical profession, you should not take it as business. All right. I don't say you don't charge anything or there's no fees for it, but do not take this as medicine. These days, I see there are dental spas, there are dental, massage centers, there are dental, franchisees. Um, I don't know why, but it just doesn't fit in my brain that dentistry is not considered to be as multi-level marketing, or the business strategy, or the corporate strategy. You can have good setups, you can have multiple branches, but do not at any point of your life, do not think it as business. Because the moment you think it as business, the moment you start imagining patients as your consumers or clients, or whatever format of business consumers you take, once you start thinking the patients as consumers or products, or the money lending machines, that's it, that is your downfall. Okay, you may earn money, but you will fall down, you will stoop down. So do not take dentistry for business. Okay, and I don't say you don't do business, but don't take it as business. Very very important to differentiate these two, right? Very important to differentiate that, right? Then the following question comes: you don't understand money. Usually in dental colleges or dental profession, money is not taught to you. That is the reason why most of the dentists fail, because they don't know how money, they don't handle money properly. So dentists should learn about money, should learn about managing your clinics, should learn about different sorts of different sources of income, at the same time different areas where you have to invest, different areas which you should not invest. So learn this. If you want something on that, if you want something on the money aspect of dentistry, uh, put in the comment section. I'll definitely make a video on that, right? Do not overjudge money. And you generally, dental students don't understand money. They think charging more is like business, charging less is like charity work. They don't know the exact fixed price. They don't know whether they have to charge 5,000 for an impaction or 300 for an impaction. They really don't know. Either they overprice it, they underprice it, and they don't know where to charge. That subtle aspect will come where you understand patient is having pain. As a doctor, your duty is to treat. At the same time, you cannot charge them for the treatment. So there's a subtle line in between. You charge, at the same time you don't do it as a business. Okay. So so there was a question one of the students asked me, how do I know, okay, how do I know that this patient is genuinely poor, or if we don't standardize the rates, or if you don't put up one rate, how will we know whether he is really a poor patient or generalized poor patient, or he is trying to cheat me. Things happen. They come with severe pain and all. They act as if they don't have money. Then suddenly, when you say ceramic cap, no, 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 I want zirconium cap. So that difference comes. So how do you know whether you have to take it as genuine patient or give it as charity? Okay, this is also very important. You gain this by slow, constant clinical practice, and that is the reason I say don't look it as business. The moment you see it as business, the moment you charge, the moment the patient comes in, you charge as a business, or as a for the material, for the crown, for the cap. That's it. You are done for the day. You have to develop skill. Your materials doesn't dictate what you are doing. The gluting cement doesn't dictate, or your composite doesn't dictate your rates. You as a person, you as a skillful professional, will dictate amount of money you have to the amount you have to charge. So remember this, and develop your skill rather than charging patient based on the material. Zirconium cap this much, and this cap this much. So the patient will go around like shops, 10 shops he goes for window shopping. He chooses what zirconium, what company, then Googles, then see these things will stoop you down to an very very bad level. So I want you to understand, do not charge in your clinics based on the materials you use. You may use whatever material you want, okay, but you developing that skill, and once you put something in the patient's mouth, and that's it, that should be his final destination. Only then only then you will understand dentistry well. Otherwise, no matter how good material you use, you will slowly become a shopkeeper, and things will change. And few things dental students usually neglect during their studies is research and entrepreneurship. These two things generally dental students neglect, and that is the catch where you misunderstand entire dentistry and money involved in dentistry. So generally, when you are in your first year, second year, third year, fourth year BDS, understand that is whatever you're learning in college is not what you apply outside. That's a basic. That is a basic. That is important for you to study. At the same time, you have to keep looking forward for what you want to do in future, and that no dental college will teach you the economics part of dentistry, the the financial part, the saving part, the entrepreneurship part, the management part. No dental college will teach you that. They may have one or two sessions as as a curriculum, but they will not teach you anything in classrooms. That you should keep in mind, the research part of it and the financial part of it. You have to learn by your own. So whoever is watching this video, remember that once you take up dentistry, once you start dental college, you should remember that in future how you're going to earn money, how you're going to employ people, or how you're going to deal with your patients, how you're going to talk about finances, how you are managing your clinic, how will you how you will you grow as a clinician, at the same time how will you earn that respectable position in society, at the same time earning money, right? So these things you should start thinking now. Later, after internship or after PG, it will be too late for you, because almost six batches students might have passed out and they will be in the same thinking mode. So start from day one. Once you join dentistry, what is that thing which will give you money, which will give you fame, which will give you satisfaction, which will give you a life and as a whole. So think on that. Become an entrepreneur, become manage your clinics, or manage your patients, become doctors, become professionals. That's very, very important. These things you forget, then you repent. Okay, so now the solution part. So you know that you have to start thinking about dentistry, the money, the economics of it, the basic doctor quality. So how do you balance all this is the question. So I will give you a few quick tips for all the youngsters. I know there are seniors who are watching my videos, and I respect them. I respect their time. Their time was different, but now the time is different. So start thinking like this. One is always associate yourself with someone bigger than you. Very, very important. Do not stick on with those clan or those fools and keep bragging about things. So first of all is stay with someone better than you, someone doing great in life, someone doing great in dentistry. Always associate with them. One. The other thing is think about research, new projects, new things coming into the market, everything new in dentistry. Very, very important. The other important aspect I want all the students to understand is money will come to you. Always think about innovation and skill. Money will automatically come to you. This is not some cinematic quotation I'm telling you. I'm telling you, try my technique. It may take 1 year extra, but follow me. Always try to understand a new thing or learn something new, learn some new skill. Do not fall behind money. Money will automatically come to you. I'll give you in writing. Try something new. And four is exercise and develop that passion to do something good. Suppose today morning if you get up and feel, "Bah, what should I do now?" That's it. Your life ends there. The moment when you're sleeping, you should be ready. Tomorrow morning I should get up and do something. This I should have. If you're not having any plan what to do tomorrow, then you will be in those 90% people who will always have complaint about everything in this world. There are students who complain about there are no government jobs, no financial support, no families. For something, some reason they will have. So think from day one. Start thinking new. Start investing your time in something new. You may not get very good academic marks. 50% is a pass mark. Get 51. No one is going to ask you, right? But start investing your time in something new, something good, something extraordinary, which can change your life. Okay, this is very, very important. The other very, very important, very, 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 very important. I wanted to give 100 veries to this is think to serve society in whatever format. Serving society is very, very important. Where you live, you have to serve them. When you start having that mindset of serving does not mean charity. I tell you again, serving Do some good to people, do some good to people, give alternative, give solutions. Once you start thinking in that format, solution format, suppose there is a suction apparatus which is not working properly, suppose the dental chair suctions are always, they don't work properly, invent a new suction material or import a suction from different country and sell it here, it will work. So not only selling, I'm telling you some problem which patients or staff or doctors face, you try to solve that, you become big, you become bigger than anyone expects in dentistry. So start thinking in this way and try to become solution for some problem, try to serve the society. Then money, you see, money will run behind you. I'm telling you, more than money, power is important. To get that power, you have to be with people, you have to serve people, you have to, do good, genuinely do good. Once you start genuinely doing good, people will love you, people will trust you, people will, they, this is not some created mindset, I will do this to good people and people will vote me. No, you have to genuinely be good. Once you start being good and once you realize that only God can heal pain and dentist can remove pain, and when dentists can remove pain, dentists become gods. Only when you wholeheartedly accept this, then you become gods, then you can, turn your career in whatever format you want. Try to understand my expression. Try to, all the students, I tell you, follow these few techniques from the day one. Whatever profession you are in, suppose you are not in, I see so many views coming from non-dental medical students. I'm telling you, in whatever field you are, I want you to be genuinely good, genuinely best in your profession, and you will be in flying colors. Don't worry about it. So there are students who come to me now asking about going abroad, going here, there. I tell you, wherever you go, whatever you do, whatever you, be genuinely good, be genuinely, try to give society as much as possible. Once you start giving society, you will not know, doors will open, sky will tear open, and you will get money. So genuinely be good, do good, then I'm sure you will be successful one day. If you still have some doubts, you still have some problems, please message me or contact me. If you don't want to put it in the comment section, mail me drharsh harish tennet@gmail.com. I got almost 50 mails asking different questions. I've answered them personally. There are some videos pending because I'm little busy. I'm now in a rural practice. There are some surgeries happening outside my place, so I'm constantly traveling, so I'm unable to make some videos. But definitely I remember everything, I note down. I will definitely make videos. I'm pending with one surgical video of MPDS also. And there are so many videos I have to make. I will definitely make some videos, and I am sure I am genuinely, I really want to help. See, this is not for some subscriptions, and I don't earn anything. I earn a lot of money. So not with these subscriptions I wanted to earn money, but I'm genuinely, I wanted to give that positivity to dental students, and I want all the dentists to rock, right? Okay, happy Diwali once again.